Dr. Greenberg just asked me if I would briefly introduce myself, given the fact that one of our panel speakers is not yet here. Let me start by saying that it was a dark and stormy night in 1945 when my mother was taken to the maternity ward. My name is Stephen Teret. I'm a professor at Johns Hopkins School of Public Health. 30 years ago, I had the pleasure of teaching Dr. Stephen Hargarten. I thought we taught him about public health, so I was surprised to see the pictures that he was showing this morning. I didn't bring any pictures like that on my slide tray, but I do have on my iPhone one of my wife getting a spider bite on vacation, and I could pass that around if you'd like to see another trauma picture. But instead, why don't I talk to you about safer guns? So in talking to you about this topic, I'm probably going to use the term personalized guns frequently, but when I say personalized guns, I'm using that synonymously with smart guns, safer guns, child-proof guns, owner-authorized guns, and others have some other terminology for the product. And let me start with a definition of what I mean by when I'm talking about personalized guns. So I'm talking about a gun that has built into it by the design of the gun that's integral to the gun itself, as opposed to an aftermarket device that you could purchase like a gun lock, a gun that can only be fired by its authorized user or users. And with regard to the need for personalized guns, I'd like to make the argument to you that the gun deaths and the gun morbidity that we've heard about yesterday and that we've already heard about this morning from Dr. Hargarten could be reduced if we change the design of guns. So actually, let me follow up with something that Steve was saying about public health. In the world of public health, what I like so much about public health is that we don't focus solely on the behavior of an individual if we're trying to solve a problem. Not that focusing on the behavior of an individual isn't a wise thing to do. We should be doing that, and in public health, we are concerned about doing that, and we want to develop better and better ways that we can alter the behavior of individuals, but we don't restrict ourselves to that. So as Dr. Hargarten was saying, we look at the environment in which things happen, and very importantly, we look at vehicles or vectors. So in terms of gun violence, the vehicle of gun violence would be the bullet, as Dr. Hargarten was saying, and also the gun itself, that which delivers the fatal blow to the individual who has been shot. There are people in my school who are working on malaria, and many people, and when they're doing that, they're not restricting themselves to trying to alter the behavior of a person who might be bitten by a mosquito. They're trying to actually change the mosquito. So we have people in laboratories in the buildings at Johns Hopkins School of Public Health who are actually engaged in trying to redesign the gut of the mosquito. By changing guns, it's again, a very typical public health thing to do, just as when we were concerned about the number of motor vehicle fatalities that were occurring. I think it was Garen Wintemute, another former student, who said yesterday that the time has come, it may have been David Hemingway, I'm sorry, I can't remember, that the time has come when there are going to be more gun deaths per year in the United States than motor vehicle deaths. When I started in public health, there were more than 52,000 motor vehicle deaths per year. That number has been reduced to about 34,000 or so. That's one of the great success stories of public health and the field of injury prevention and the people with whom Dr. Jim Mercy works at Centers for Disease Control, as well as the National Highway Traffic Safety Administration. We may be able to do the same thing about gun deaths. So instead of gun deaths continuing to climb, we need to see that be turned around with a reduction in gun deaths. And one of the ways of doing that is not to continue to build as many guns as can feasibly be sold each year in the United States, but to alter the design of guns like we altered the design of cars. We put airbags, safety belts in cars. We can change the design of guns to make them personalized guns, smart guns, so that they would not be as dangerous a consumer product. We need to personalize guns to reduce unintended gun deaths, suicides, and homicides. With regard to unintended deaths, although it was discussed yesterday that if you look at a mortality pie chart of gun deaths in the United States, the slice that represents the unintended deaths, thankfully, is a very small slice. It's come down in the last couple of decades in terms of the percentage of all gun deaths that are unintended gun deaths, but they're still troublesome deaths. They're especially troublesome when a young child finds a gun in the home, a gun that perhaps is kept there with the intention that it's going to provide protection for the people in the home, when actually it provides peril for the people in the home, and that young child is able to pick up the gun and to operate the gun, to shoot the gun, to shoot a sibling, to shoot a playmate. Those are particularly tragic kinds of deaths. With regard to suicide, if we had personalized guns, then some of the, particularly the youth suicide, the teenage suicide, may be reduced because the gun would be inoperable by a depressed teenager who picks up a gun and tries to come up with a permanent solution to what might have been a temporary problem that he or she was facing with depression, and uses the gun to fatally injure himself or herself. And with regard to homicides, personalized guns, again, could intervene because there are an estimated 350,000 to 500,000 guns that are stolen from homes during burglaries every year in the United States. Those guns enter the illicit market and are used in crime including homicides. And if the gun were manufactured so it was one that would operate only for the authorized user, then if it were stolen from the home, it's going to be of little value and it's not going to be used in assaultive behavior. Just to, it's hard to measure, though, how many lives would be saved, whether they're lives taken by unintentional gun deaths or suicides or homicides. It's hard to do a quantitative analysis because, in fact, the intervention hasn't been brought to bear yet. We haven't run the experiment. So we need to run the experiment by putting personalized guns into the marketplace, and then we'll know more how many lives will be saved. But I can tell you that there was some work that was done, particularly with unintentional firearm deaths, trying to ascertain how many lives would be saved. The work was done by looking at medical examiner records. The person who was the lead author on it is Jan Vernick from Johns Hopkins School of Public Health, but Dr. Hargarten was also an author on this article on injury prevention in 2003. And their findings in looking at medical examiner records, both in Maryland and in the Milwaukee area in Wisconsin, was that 37% of the deaths that they looked at would have been preventable had the gun been a personalized gun. So let me give you a very brief history of personalized guns before we talk about policy issues. This is a gun that was made by Smith & Wesson. The reason that it was made is because, according to the history of the corporation, in essence the biography of the corporation of Smith & Wesson, that D.B. Wesson, one of the founders of Smith & Wesson in the 1880s, heard of a young child who operated a gun and shot another person, and he felt that that should just not happen. Why is it that children are able to use their guns? You know, we make aspirin bottles so children can't use them. Why are we making guns that young children could use? So D.B. Wesson asked his son, Joe Wesson, who is a gun designer, to design a child-proof gun. And Joe Wesson did do that. The gun was designed in the mid-1980s. The sale of the gun started in the late 1980s. And if you see where the red arrow is pointing, that's called a grip safety. And that metal lever in the backmost portion of the gun has to be depressed by this part of your hand, which Steve Hargarten and others have taught me is the thenar eminence, which initially sounded like a Mideastern ruler to me. But it's this part of your hand has to depress that metal lever. At the same time, the trigger is being pulled. If you're not depressing the lever while pulling the trigger, then you can't pull the trigger and the gun won't operate. The idea of Smith & Wesson was that the child's hand, and they specifically said a child under the age of 6 in their advertising, was both too small and not strong enough to accomplish both of those tasks at the same time. So Smith & Wesson made about 500,000 of these guns and sold them from the late 1880s until 1940. They don't use this rudimentary childproofing technology on their guns now. And if you think about why is it that they don't do that, you'd have to ask Smith & Wesson. But for me, the point is they don't need to do that because we as a society in the United States do not regulate the safety of guns as we regulate the safety of other products. The Consumer Product Safety Commission has been expressly banned from exercising any jurisdiction over firearms or ammunition by Congress. Another gun, and this goes back to the early, excuse me, I think we skipped a slide, 2 slides. Whoops. No, I want the next slide. Thank you. Nope. Yep. Thank you. This Fox carbine was made around 1970 or so, and where you see the blue arrow, there's a simple combination lock. So you have to dial in 3 digits in order for the gun to work. Without having those 3 digits, the gun isn't going to work. So again, it's another rudimentary form, in my mind, of a smart gun. Taurus, a Brazilian gun manufacturer, made a gun using what they call the Taurus security system, which has a lock and key mechanism. And back in 1992, I and my colleagues decided to give some engineering students at the Johns Hopkins Whiting School of Engineering $2,000 and a revolver that we made inoperable. We put material into the barrel of the gun, or as Dr. Hargarten would say, we occluded the orifices of the gun, and so that it wouldn't work and wouldn't harm the students. But we asked them to make it into a personalized gun, and they used what's called a touch memory system. I actually thought that this would be, if it became widespread in use, this would be one of the greatest boons to gun control if someone had to carry around a gun that looked like that with wires coming out and a big thing in your pocket. But this was just a prototype to show that guns could be made. If you used electronics in guns, guns could be made so that they were personalized because you had to touch a particular device to a point on the gun in order for a blocking mechanism electronically to move and for the gun to become operable. In modern personalized gun technology, we have a gun that's made by Armatix, which is a corporation in Germany, but there's a United States subsidiary, Armatix USA, and the Armatix gun uses radio frequency identification, what's called RFID in the industry. So built into the wristwatch is a chip, in essence, that transmits to the gun. And if the gun is within 10 inches or so, but that distance can be manipulated if needed, then the gun knows that it's in the hand of the authorized user, and the gun will operate. If the gun is taken by someone else, either an assailant or a young child or a depressed teenager, then the gun is not going to be operable. And similarly, there's another company called Trigger Smart, which is located in Ireland, which is also using radio frequency identification or RFID technology in slightly different ways to make a personalized gun that's not yet on the market. The Armatix gun is about to be on the market, but there are other guns that probably soon will be on the market that use biometrics instead of RFID technology. For instance, guns that read your fingerprint and know that you're the authorized user, and they won't operate if the right fingerprint hasn't been on them. This used to be thought of as technology that we would never see in guns, but the technology is now becoming more commonplace. So on some types of phones, you have, this one is not a fingerprint reading, I'm trying to fool you in that regard, but there are other types of phones made by the same manufacturer, which I probably am not allowed to mention because we don't want to endorse products here, but you touch your finger over here, it reads your fingerprint, it knows that you're the authorized user of the telephone. The same thing can be done with guns. It used to be thought that the computer chips would not be durable to withstand the repeated trauma of a gun being operated, but the technology has developed. So we're in a world now where the technology is not the stumbling point for bringing personalized guns to the market. And let me talk to you in my remaining minutes then about some of the socio-political opportunities and obstacles for introducing these personalized guns into the marketplace. If technology is there, presently there, so we can make these guns available to the public, then why aren't we making the guns available to the public? I don't know how visible this is from where you are, but if you think of a 2x2 table, which epidemiologists are fond of using, then if you think on one axis, that would be the vertical axis, if you think of gun control, and I put that in quotation marks because it's a phrase that many of us don't like to use because it conjures up things that anger some people, but let me just use it for purposes of this. If you think that there are people who favor gun control, traditional gun control issues, and there are people who oppose gun control issues. The same is true with about personalized guns in particular. There are people who favor it and people who oppose it. So you can make this 2x2 table. Now, where you put individuals on this 2x2 table, in which of the four quadrants you put people, might seem axiomatic, but it's actually a little bit more complicated than what one might think of at first blush. The arguments are not wholly restricted to what one would think of as party lines of people who favor gun control or oppose gun control, or people who favor or oppose personalized guns. So for instance, if you look at the quadrant that's marked 2 there, that's people who favor gun control but who oppose personalized guns. Now that's a quadrant that has a very low population density. There are not many people who favor gun control but oppose guns, but there are in fact some. And the reason that they oppose personalized guns, they say, is that if you increase if you make personalized guns available, you might increase the prevalence of personalized guns in households, and with an increased prevalence of personalized guns in households, then maybe you'll have more gun-related injuries. The difficulty in assessing the arguments in these quadrants, again, is that we haven't yet introduced personalized guns into the marketplace, so we don't know empirically what's going to happen, but we can make some good guesses about what's going to happen. So in quadrant number 1, the people who traditionally favor gun control and who favor the introduction of personalized guns feel that there will be reductions in homicides, suicides, and unintended deaths. As I mentioned to you a couple of moments ago, the technology exists, that personalized guns don't interfere with anyone's Second Amendment rights, which is obviously of great importance to those who oppose gun control, and that all consumer products, guns being one of them, should be made as safe as is feasible. So why aren't we making safer guns? If you look at the fourth quadrant, the quadrant marked number 4 there, that's people who oppose gun control and who oppose personalized guns. So we might find that quadrant to be occupied by organizations like the National Rifle Association and the Trade Association for Domestic Gun Manufacturers, which is called the National Shooting Sports Foundation, or NSSF. So they like to say that they're not opposed to the development of technology, but they're opposed to the mandate of technology in guns. Now, I had not given much thought to the quadrant that's marked 3 there until recently, which is people who oppose gun control but might favor personalized guns. There were 2 incidents that arose in the last several months, one with a gun retailer in California and one with a gun retailer not far from where we are now in Washington, D.C., in which they wanted to start the sale of personalized guns, more particularly the Armitex personalized guns. But these gun retailers received death threats from people, and the death threats were that they should not sell a personalized gun because that would trigger a law that was passed in New Jersey well over a decade ago that said once a personalized gun is sold anywhere in the United States, then a clock starts ticking in New Jersey, and 3 years after that date, then the only kind of new handgun that could legally be sold in New Jersey would be a personalized or a childproof gun. They didn't want that New Jersey law to take effect, so people made death threats against these 2 retailers who were about to sell these personalized guns. Because of the death threats, they did not sell the guns. But their argument, particularly the argument of the retailer in the state of Maryland, not far from here, was that he thinks that everyone should have a right to own any kind of gun they want in the United States, so why shouldn't he be able to sell personalized guns? And his other thought was that maybe there are people out there who haven't bought a gun because they're afraid that a child would find the gun and be able to use the gun. And if it were a personalized childproof gun, that would open up another market for him. In order to influence the American population, we've sometimes thought of trying to move people from quadrant 4 into quadrant 1. That, I think, is a near impossibility. But we've not given thought to moving people from quadrant 3 into quadrant 1. And I think, based on what's happened in the past few months, that is a possibility. So the basic conclusion then is that personalized guns do exist, although you can't find them on the market in the United States yet, but that's probably likely to change. When they do enter the market, and when people start buying them instead of the old unsafe guns, and when they start to have enough of a market share, then I and others think that the likelihood is that we'll see a reduction in homicides and suicides and unintended deaths by making guns a safer consumer product, just like we've done with other areas within public health and reducing consumer product fatalities. Thank you very much.